Below are 50 MCQs on acid-base maintenance for applied biochemistry nursing, each with answer one-sentence explanation. Number 50 MCQs, acid-base maintenance with answers and explanations. Hasher pH, definition and normal value. 1. pH is defined as A. Log of hydrogen ions, B. Negative log of hydrogen ions, C. Concentration of OH- ions, D. Concentration of acids in blood. Answer B. pH is defined as the negative logarithm of hydrogen ion concentration. 2. Normal arterial blood pH is A 6.8 to 7.0, B 7.5 to 7.2, C 7.35 to 7.45, D 7.5 to 60. Answer C. Normal arterial pH ranges from 7.35 to 7.45. 3. A pH below 7.35 indicates A. Alkalosis, B. Acidosis, C. Normal range, D. Hyperoxia. Answer B. pH 7.35 signifies acidosis. 4. A solution with high hydrogen ion concentration will have A. High pH, B. Low pH, C. Neutral pH, D. No pH. Answer B. Higher H-bias ions lower the pH value. 5 pH is measured on a scale of A 0 to 7, B 0 to 10, C 0 to 14, D 7 to 14. Answer C. The standard pH scale ranges from 0 to 14. Regulation of blood pH. Buffers, respiratory, renals. 6. The fastest mechanism for regulating pH is A. Renal system, B. Liver, C. Respiratory system, D. Bone. Answer C. Respiratory regulation adjusts CO2 levels within minutes. 7. The most important extracellular buffer system is A. Hemoglobin buffer, B. Protein buffer, C. Phosphate buffer, D. Bicarbonate buffer. Answer D. The bicarbonate buffer system is the primary extracellular buffer. 8. Bicarbonate buffer consists of AH2CO3 HCO3 needs B, HPO4 slice HGPO bumsine, H3 and H4 bice D, ACE D, HCl Cl maris. Answer A. The bicarbonate system uses carbonic acid and bicarbonate. 9. Carbonic anhydrase catalyzes the conversion between A. HCO3 and B, B. H2CO3 and CO2 plus H2O, C. HCl and NaCl, D. H2O and H2O2. Answer B. Carbonic anhydrase interconverts carbonic acid and CO2 H2O. 10. Kidneys compensate for acidosis mainly by A. Retaining CO2, B. Excreting H by C. Producing more CO2, decreasing bicarbonate. Answer B. In acidosis, kidneys increase H by excretion. 11. Kidneys compensate for alkalosis by A. Excreting HCO3 B. Retaining bicarbonate, C. Increasing acid production, D. Decreasing urine output. Answer A. Excess bicarbonate is excreted during alkalosis. 12. Respiratory acidosis is caused by A. Hyperventilation, B. Vomiting, C. Hypoventilation, D. Hyperkalemia. Answer C. Hypoventilation retains CO2 causing acidosis. 13. Hyperventilation leads to A. Respiratory acidosis, B. Respiratory alkalosis, C. Metabolic acidosis, D. Metabolic alkalosis. Answer B. Excessive breathing removes CO2 causing alkalosis. 4. Kidney buffer involving ammonia includes A. H2CO3, NH3 plus H minus NH. Answer B. Ammonia buffer excretes H dyes by forming ammonium. 15. Which is a major intracellular buffer? A. Bicarbonate, B. Plasma protein, C. Hemoglobin, D. Phosphate. Answer C. Hemoglobin is the key intracellular buffer in RBCs. ABG normal values. Normal value is A 10-20 millihertz, B 22-28 millihertz, C 35-60-80 millihertz. Answer C. Normal arterial CO2 is 35 to 45 milligrams. 17. Normal HCO3 level is A 10 to 14 micromolar, B 18 to 23 milliliter, C 22-26 milli, D 30-40 milliliter. Answer C. Typical bicarbonate level is 22-26 milliliter. 18. Normal PaO2 is A 20 to 30 millimeter, B 40 to 60 milligrams, C 80 to 120 to 140 millimeter. Answer C. Normal arterial oxygen pressure is 80 to 100 millimeter. Normal oxygen saturation SO2 is A 60%, B 75%, C 85%, D 95 to 100%. Answer D. CO2 95% is normal. 20. Increased PaCO2 on ABG indicates A. Hyperventilation, B. Respiratory alkalosis, C. Respiratory acidosis, D. High oxygenation. Answer C. High CO2 causes respiratory acidosis. Acid-base disorders types, causes, definitions. 21. Metabolic acidosis is characterized by A. Low HCO3, B. High HCO3, C. High CO2, D. Alkaline urine. Answer A. Low bicarbonate indicates metabolic acidosis. 22. Cause of metabolic acidosis. A. Vomiting, B. Diarrhea, C. Hyperventilation, D. Excess antacids. Answer B. Diarrhea causes bicarbonate loss. 23 causes metabolic alkalosis. A, diabetic ketoacidosis. B, renal failure. C, severe vomiting. D, hypoventilation. Answer C, vomiting removes gastric acid causing alkalosis. 24, respiratory alkalosis is due to A, hypoventilation. B, diarrhea. C, anxiety. Renal failure. Answer C, anxiety triggers hyperventilation, respiratory alkalosis. 25, compensation for metabolic acidosis. A, hypoventilation. B, hyperventilation. C, decreased NH3. D, decreased urine output. Answer B, lungs blow off CO2 to correct acidosis. 26. Ketoacidosis is an example of A, metabolic acidosis, B, metabolic alkalosis, C, respiratory acidosis, D, respiratory alkalosis. Answer A, ketone accumulation lowers pH. 27. COPD commonly causes A, respiratory alkalosis, B, respiratory acidosis, C, metabolic alkalosis, D, metabolic acidosis. Answer B, chronic CO2 retention leads to respiratory acidosis. 28. Excess antacid ingestion causes a metabolic acidosis. B, metabolic alkalosis. C, respiratory acidosis. D, respiratory alkalosis. Answer B, antacids increase bicarbonate alkalosis. 29. Salicylate overdose initially causes A, respiratory alkalosis. B, respiratory acidosis. C, metabolic alkalosis. D, none. Answer A, early stimulation of respiration lowers CO2. 30. In renal failure, acid-base disorder seen as A, metabolic alkalosis, B, metabolic acidosis, C, respiratory acidosis, D, respiratory alkalosis. Answer B, kidneys fail to excrete acids, metabolic acidosis. Mixed disorders and general concepts. 31. In metabolic acidosis, pH is A, high, B, normal, C, low, variable. Answer C, low bicarbonate lowers pH. 32. In metabolic alkalosis, CO2 compensation is A, decreased ventilation, B, increased ventilation, C, no change. D, increased renal acid excretion. Answer A, lungs retain CO2 by slowing breathing. 33. Compensation for respiratory alkalosis. A, kidney excretes bicarbonate. Kidney increases bicarbonate. C, lungs slow down. D, lungs speed up. Answer A, kidneys excrete HCOs to correct alkalosis. 34. Which organ removes volatile acid? A, kidney. B, liver. C, lungs. D, stomach. Answer C, lungs excrete carbonic acid as CO2. 35. Which organ removes non-volatile acid? A, lungs. B, kidney. C, skin. D, brain. Answer B, kidneys excrete fixed acids like phosphates. 36. Alkalosis increases binding of calcium to albumin, causing A, hypercalcemia, B, hypocalcemia, C, hyperkalemia, D, hyponatremia. Answer B, alkalosis reduces free calcium levels. 37. A patient with severe diarrhea most likely has A, metabolic alkalosis, B, metabolic acidosis, C, respiratory alkalosis, D, respiratoreosis. Answer B, bicarbonate loss in stool causes acidosis. 38. Which increases risk of respiratory acidosis? A, panic attack, B, asthma attack, C, vomiting, D, diarrhea. Answer B, airway obstruction retains CO2. 39. Which increases risk of metabolic alkalosis? A, renal failure, B, shock, C, gastric suction, D, DKA. Answer C, suction removes stomach acid. 40. An elevated HCO3 indicates A, metabolic acidosis, B, metabolic alkalosis, C, respiratory acidosis, D, respiratory alkalosis. Answer B, high bicarbonate is alkalotic. Further MQs. 41. Normal anion gap is A, 1 to 5, B, 2 to 10, C, 8 to 12, D, 20 to 30. Answer C. Normal anion gap is 8 to 12 mQ/L. 40. High anion gap acidosis occurs in A, vomiting, B, lactic acidosis, C, diarrhea, D, renal bicarbonate loss. Answer B, lactic acidosis increases unmeasured anions. 42. Which is not a buffer system? A, bicarbonate, B, phosphate, C, albumin, D, glucose. Answer D, glucose does not act as a buffer. 44. The Henderson-Hasselbalch equation relates pH to A, Na- and K-pace, B, HCO3- and CO2, C, H2O and O2, D, C, Ca-quasa and PO quarter-minis. Answer B, it uses bicarbonate and carbonic acid ratio. 45. Respiratory acidosis results in A, increased pH, B, decreased pH, C, no change in pH, D, increased oxygen. Answer B, CO2 retention lowers pH. 46. A patient with fast breathing and tingling fingers likely has A, metabolic acidosis, B, respiratory acidosis, C, respiratory alkalosis, D, metabolic alkalosis. Answer C, hyperventilation causes alkalosis. 47. Excessive exercise can cause A, lactic acidosis, B, lactic alkalosis, C, respiratory alkalosis, D, metabolic alkalosis. Answer A, exercises increase lactic acid production. 48. Loss of H from vomiting leads to A, increased bicarbonate, B, decreased bicarbonate, C, respiratory compensation, D, low pH. Answer A, acid loss raises bicarbonate level. 49. A patient with COPD will have elevated A, pH, B, PaCO2, C, HCO3- D, both B and C. Answer D. CO2 retention raises PaCO2 and kidneys compensate by increasing HCO3 maintenance. 50. The primary indicator of metabolic disorders is A. PaCO2, B. HCO3 maintenance, C. PO2, SaO2. Answer B. Bicarbonate reflects metabolic status. Thank you. Have a nice day.